So, the Kevin Durant injury has been confirmed. He has an Achilles tear. So now, I guess the questions arise. Number one, should he even have been playing? Number two, should athletes have their own doctors? And number three, what's next for him? Hey everybody, Dr. Chris, orthopedic surgeon and sports medicine physician, and today I'm going to talk about the Kevin Durant injury and all of the controversy that has arisen as a result of it. Previously, Durant had injured himself on May 8th of the Western Conference semifinals. He apparently suffered a calf strain of his right calf. He pushes off of his right leg as he is driving to the hoop. Immediately after making his initial move, he kind of stumbles. He turns to walk off the court as he knows that something is wrong. On his Instagram post, he confirmed that he'd suffered an Achilles tendon injury. He didn't actually say it was a rupture, but he did confirm that he had suffered an Achilles tendon injury, and he also said that he had successfully undergone surgery. I had commented in a video that I posted immediately after his injury that it was an Achilles tendon tear or rupture until proven otherwise. But I am telling you that this is an Achilles tendon tear of a high-grade nature until proven otherwise. We put that video out, and he put up his Instagram post approximately 1 or 2 hours after our video went live. There's a few things that are interesting about this situation. There's controversy about whether or not he had previously suffered a Achilles tendon injury. My gut suspicion is that they probably knew he had an Achilles tendon injury of some sort. Obviously, he didn't have a rupture, but he may have had significant tendonitis of his Achilles tendon with possibly a partial low-grade tear, which he'd suffered a month ago. So I think that that's probably what he had, but in order to downplay that situation so that the Raptors would not know that that was going on, I think they said it was quote-unquote a calf strain. So it's my own gut suspicion that he had an Achilles tendon problem and that they downplayed it and said it was a calf strain. Well, we know that these type of injuries typically don't happen just in normal, robust tissue unless it's under a very, very significant load. So in other words, he would have had to have, been pushing something extremely heavy or trying to decelerate from a very high height, landing from a very high height, or trying to change direction in an extremely ballistic manner. This is not the kind of thing that would have happened in perfectly healthy tendon tissue if he was just pushing off and driving to the hoop. So usually these kinds of ruptures are going to occur in tissues that have had tendonitis. And tendonitis is a chronic inflammation of the tendon tissue. The growth rate or the rate of metabolism of tendon tissue, this connective tissue, is significantly lower than it is for the rate of metabolism for either muscle or bone. It takes that type of tissue much, much longer to repair after injury than it does for muscle or bone to repair itself. And so if you have had multiple small level injuries to the tendon because of overuse, repetitive strain, whatever, and you do not provide significant time or adequate time for it to heal itself or for it to recover, which is very difficult during the NBA season because these guys play upwards of 200 games or something like that. They're playing quite frequently and they're practicing a lot. If you don't allow significant time for these small minor injuries to recover, then what you have is a small minor injury with a fraction recovery, and then another small injury with only a fraction recovery. And over time, the injuries pile up and they outpace the recovery. So you end up with a situation where the tendinous tissue over time develops a progressive, slow accumulation of insults, and it results in tendonitis. or chronic inflammation of the tendon, and this can lead to Achilles tendon rupture. And keep in mind that a calf strain and Achilles tendonitis are two like completely different things. Although they involve the same system, they're all part of the gastrosoleus Achilles complex. They are two different things. So a calf strain is an injury to muscle tissue. And so this is where you have damaged some of the muscle fibers by subjecting them to a load which they cannot handle, either with respect to the overall force that is applied, or the length of time that that force has been applied, or the specific impulse. In other words, the speed at which that force has been applied. But through one of those mechanisms, or a combination of several, you have injured the individual muscle fibers. This has nothing to do with the actual tendon itself. A strain is a muscle fiber problem. Achilles tendonitis, on the other hand, has nothing to do with the muscle. It has to do with the tendinous portion of the gastrosoleus Achilles complex. And this is typically, as I mentioned, from a repetitive strain type of injury. And over time, you have small insults to the connective tissue, the tendinous material, and then you eventually develop chronic inflammation in the tendon. So strain has to do with the muscle, tendonitis has to do with the tendon. So do I think that KD should have been playing in the playoffs? I'm going to say some things which are pretty controversial, and these are not my own personal opinions. This is just the way that I believe the system is. At the end of the day, KD, Kevin Durant, yes, he is an amazing athlete. He's a great guy. I have nothing against him, and I wish him all the best in his recovery, and I hope that he gets back to playing NBA basketball at the same level or better than what he was playing previous to his injury. But having said that, basketball is a business. It is a huge money-making business. And Kevin Durant is an integral part of that money-making business. But Kevin Durant is not able to help make money unless his team is doing well. So this is the NBA Finals. And the NBA and respectively the two teams involved, the Warriors and the Raptors, the longer that they are able to play and the more games that they are able to play in, the more money that they as teams are able to make and the more money that the NBA is able to make. So there is a vested interest in having the series go to a game 7. So that's everybody wants that. Well, the Raptors don't want that, I guess, but everybody else wants that from the Warriors and basically the fans. They may not say that they want that, but of course there's more drama if it goes longer. So they want that, and the NBA, of course, wants that because it's more money, more marketing dollars, more views, all that. When you're faced with this situation, you have 3 games to 1, and you need 4 games to win the series. Even if KD has an injury, at some point somebody's sitting down thinking, well, geez, it's 3 games to 1. If we lose this next game, the Warriors are out. NBA Finals, done, right? And so far, the Warriors, with all the firepower that they have, they've only been able to successfully win 1 game. Kevin Durant has been gone for this whole series with the Raptors. So somebody high up is thinking, well, Kevin Durant could be the spark plug that gets our engine going and helps the Warriors to come back and finish the series, or at least prolong it to game 6 or 7. As I said, it's a business, and this is a calculated risk. When they looked at this situation, I'm sure they said, well, what is the chance that his Achilles tendon will rupture? What is the chance? Then they say, well, what is the chance that we will progress to game 6 or game 7 if Kevin Durant is available? He's one of their marquee players. If they feel that it's a high enough chance that they will progress, and it's significantly higher than the likelihood his Achilles tendon will rupture, at the end of the day, Kevin Durant is a tool in their toolbox. and they are going to use every tool that is available to allow them to get to the next level to fulfill their goal. He is basically a commodity in this equation. They look at the numbers and they think, is the risk worth it? They figure, oh, we're at the end of the season. If he injures himself, he's got the off season to recover. So is the risk worth it? Yeah, you know what? We're trying to build a dynasty here. We've won it several times. We want to win it again, and we think it's worth it. Put him in. So should he have been playing? From a medical perspective, hell no. He should not have been playing, because in my medical opinion, this was clearly a tendonitic Achilles tendon. He had been off for 4 weeks prior to this, and that's not nearly enough time for an Achilles tendon injury to heal. He hadn't been able to practice. He had only been in controlled scrimmage, and he hadn't been playing at full intensity, so his ability to do so was questionable. An Achilles tendon that has had chronic inflammation from tendonitis and has been aggravated by an injury only 4 weeks prior is in no shape to take the rigors of full-on 100% intensity basketball play. I can't second guess any other physicians. I just know that I would have counseled him significantly on the risks that he was taking. And I would have told him, dude, this is a risky proposition. Please make sure that it is worth it to you before you decide to go into that game. That's what I would have said. So I would not have stood in his way, but I would have strongly cautioned him against it and explained the risks to him. So this leads to the question then, should athletes have their own doctors? And usually each team has their quote-unquote team doctor. I myself am one of the team physicians that is involved with a university football team. When you are a team physician, you have the medical responsibility to the patient. Part of the Hippocratic Oath is that, number one, we are to do no harm to the patient, and number two, we are to put the patient's welfare above all others, make sure that everything that we do is in the best interest of the patient. So yes, we have that responsibility. That being said, most team physicians are typically employed by the team. And so they also have a responsibility to the team. And in the case of professional sports, there is pressure on the physicians to make sure that the team is able to do well. And sometimes this means that there is pressure on the physicians to do things that in an isolated world away from all of the dollars of the business of professional sports, they might choose to act otherwise. When it comes to that situation where they're called to give a medical opinion, but there is the pressure of all the dollars and the real possibility that if they do not help the team to perform well and progress, that they may lose their position as the team physician, then the judgment might turn out to be other than what it would have been if you only had to take into account the patient's welfare and the long-term effects of what these injuries might mean for the patient. I don't know that this means that each athlete should have their own individual physician. This is going to make care very disjointed, and it's going to make it very problematic for athletes to be treated in a timely fashion and in a manner that's consistent with keeping them integrated into the team. But I think that athletes should have an awareness that in the end, the sport in which they play and the sport which pays them is a business. As a result, the team is going to look out for the welfare of the team first, right? And for the success of the business of that sport first and foremost. They're going to look out for that. So I think they just need to have an awareness. As much as athletes get paid, they do get paid a lot. But I would never say to an athlete that they should not take as much money as they're being offered by the team. If they can get more money, then they should take more money. And the reason being is because You are only as good as your last play, and you never know which play is going to be your last play and when that may occur. You may have an injury that is a career-ending injury, and that puts you out, and so you have to stop playing. And you want to make sure that all of the hard work that you've put into to get to that point, that it actually means something, and that you will be able to care for yourself, considering that for some sports the duration of their professional career is only 3 or 4 years. You want to make sure that you are set up financially. Athletes need to protect themselves accordingly. Don't get me wrong, it's not that I think that athletes can't do anything other than play sports and they have no opportunity to do anything else. There's lots of athletes, you know, you can see whether they're in broadcasting or whatever, that go on to other things and they're very successful. But you never know when you are going to suffer an injury that could not only change your career, but change your life. Right? And so there are athletes who have suffered injuries where they have become paraplegics, or you know, they've lost significant function of their body, and the care that's associated with those injuries is expensive, right? Especially if you live in the United States, it's expensive. So you need to make sure that you have an ability to cover those costs should the need for medical care occur. As an athlete, your sport is your craft. It is your craft. Your body, however, is the tool which allows you to perform that craft. It is the tool that allows you to do this. Without the tool, you cannot do the craft. So you need to make sure that your tool is in peak condition and in top shape at all times. And if it is not, you need to give it adequate time to rest. Otherwise, problems, injuries can occur. And to be honest, that's why injury prevention is so huge. But that is an issue, or that's a topic for another story. And so what's next for Kevin Durant? Well, obviously, as I said, he's had surgery. You can check out my previous video to know a little bit more about how that surgery is performed and the duration of time that it will take to recover from this. But in general, he is probably going to be out for 6 to 9 months, and hopefully he'll be back playing basketball next year. You know, hopefully it'll be at the same level. It's going to take a lot of work and some time for him to get there, but I do think that it is in fact possible. So I hope you've enjoyed this discussion on Kevin Durant's injury, and I do hope the best for him. I wish him a speedy recovery. I don't know exactly what type of tear he had or the repair that was performed. All things being considered, I think that he'll be able to return. And as always, that's been a word from Dr. Chris, not your everyday